Welcome to this episode of To Your Health. I'm your host, Rhonda Alfred. Tonight, we are discussing chemotherapy-induced peripheral neuropathy, or CIPN. For some cancer patients, neuropathy is one of the unexpected side effects of cancer treatment. Fortunately, Terrebonne General's rehabilitation department offers a dedicated therapy designed to help relieve the symptoms and restore patients' quality of life. I'm excited to welcome Jessica Kovar, Terrebonne General physical therapist. Jessica works with patients to relieve their symptoms of CIPN, and she's here to tell us more about what she does. Welcome to the show, Jessica.
Thank you, Rhonda.
Well, let's get started. I know you've been on the show before and you've been with the hospital for a little while. Tell us some more about what you do in your role.
Okay, well, I'm a physical therapist. I've been with Terrebonne General for a little over 5 years now. I got my doctorate of physical therapy degree in 2015 from the University of St. Augustine, and I've been with the hospital ever since then. And so I'm work full-time in the outpatient rehab department, but I've also worked in the acute care setting and inpatient rehab.
Okay, quite an accomplishment.
Thanks.
So let's get started talking about this specialty area that you help patients with. Tell us exactly what is chemo-induced peripheral neuropathy and how is it treated?
Well, peripheral neuropathy itself is basically nerve damage to the peripheral nerves, which supply the sensory and motor aspects. So it deals with sensation, the difference between hot and cold or sharp and dull types of sensation, as well as controlling movements of the arms and the legs. And so what we're seeing is with patients that have gone through chemotherapy, some of them end up with these peripheral symptoms, or chemo-induced peripheral neuropathy is one of the side effects that can cause damage, or we'll see damage in these areas.
What exactly is chemo-induced peripheral neuropathy?
Chemotherapy-induced peripheral neuropathy is the neuropathy symptoms that oncology patients may experience after going through their chemotherapy treatments. There are many other forms of neuropathy. As we know, probably the most common is diabetic neuropathy, but now we're seeing these peripheral neuropathy symptoms in patients with cancer after they've gone through their chemotherapy treatments. And so some of the side effects, as with peripheral neuropathy, is that you may have loss of sensation or impaired sensation in the hands or feet, some numbness, tingling. You also may have weakness in the arms or legs, and that may lead to also balance impairments and difficulty moving around, difficulty walking, also with fine motor skills, having difficulty as simple as something as buttoning a shirt or holding a fork or a spoon to eat.
Okay, so are these the most common symptoms of the chemo-induced neuropathy?
That is typically what we see in the rehab clinic, is that you see more of those what we call gait and balance deficits. So having difficulty walking, difficulty getting up from a chair because of the nerve damage. That's a side effect of getting the chemotherapy treatments. They may have weakness, and the nerves aren't working at I will say like 100% capacity like they should be.
Okay, I see. So are all the symptoms the same for the patients?
No, it varies depending on patient to patient, depending on the types of chemotherapy treatment they received or the dosage, and just the patient themselves. You know, I think with any of the side effects, it just depends, again, from patient to patient, you know, how it's affected their body.
So what kind of cancer patients do you treat?
Any. It just depends that if, you know, after, and again, this is going back to their chemotherapy treatments, that if this chemotherapy-induced peripheral neuropathy, CIPN, is one of the side effects that they get after, as a result of being treated, then their doctor may refer them to us dependent upon if they go to them with any of the deficits that, we mentioned before.
So if they may go to their doctor and say, hey, I'm having a hard time walking, or hey, my
Right.
fingers are tingly, then, well, it's good to know that there's a treatment out
Yes.
there. So tell me, how can physical and occupational therapy help these patients?
Well, what we are focused on is restoring the patient's quality of life, restoring their safety with functional mobility. They've gone through this process of trying to beat their cancer and, rid their body of that. And they've gone through all of the medical treatments. Now they may be left with these side effects of, debility or, deconditioning. So what we do as therapists is work with these patients one-on-one, and do a complete evaluation and see what exactly is their deficits, whether they would need physical therapy or occupational therapy. What are the deficits specific to that patient? It's not just a cookie cutter approach. Each patient is different. And so after doing a full evaluation, we would design a program specifically to their needs and also what their goals might be. If their goal is, if they're having trouble just standing from a chair, where they need their spouse to help them to get up, or, they were independent before this and now they're using a walker to have to get around. It's working on building up that strength and that endurance and working on balance. So it depends from patient to patient,
Right. Personalized treatment depending on what they need.
Absolutely.
Okay, so explain some of the treatments that you use.
We focus a lot more on gross motor aspect, where we do a lot of strengthening. If they have difficulty walking, we're going to assess the strength of their legs, their core strength, and tailor a program to focus on that. But we'll also work on balance, neuromuscular re-education, getting those nerves and those muscles firing again. So, and again, you go back to the patient and what's their goal. If it's a woman that's, at home and she wants to get back to doing her housework, we'll have her work on strengthening the legs so she can bend down and pick up her laundry basket. Or if it's a man who wants to get back to cutting his grass, we'll have him push in a weighted sled. So it varies, and it's fun, because you're tailoring it to that patient, and you're helping them reach their specific goals.
Right.
So it's always changing.
Helping them to get back to getting back to doing the things they love.
Exactly.
I mean, that's the name of the game. So how soon can patients see a difference once you start working with them?
Again, that varies. Every patient is different. We always get asked that question regularly, how long will they be in therapy? How long before they see progress? And really, it just depends. It depends on how severe their symptoms are. It depends on how compliant they are with coming to therapy.
There's homework involved.
There is homework involved. And that's the other thing, is that they don't come to therapy every single day. Sometimes we wish we could see some of our patients every day, but so we design a home program for them to do, and just encourage them to do it regularly every day. Just like you and I, staying physically active and exercising. It's not gonna magically improve with one exercise or 1 week of doing exercises. So
Right.
it's a lifestyle change, and encouraging them to continue doing their exercises at home to keep the muscles strong.
So at what point in a patient's treatment do you begin to work with them?
One thing is, it depends on how soon the patients start developing these symptoms and these side effects, and going to their doctor and being vocal and advocating for themselves, and just communicating with their doctor, saying, this is what's going on, what can I do about it? And then it would be up to the doctor to send us a referral, and we try to get them in 24, 48 hours after receiving a referral, if possible, to really get them on a program.
How can patients learn about it? You said communication.
One of the things that we're doing at the hospital is we, as the therapists, are meeting with the oncology department, with Mary Bird Perkins and their treatment team, and talking about what we do. We've also had former patients that have follow-ups with their doctors and, mention the benefits of coming. So then the doctors are seeing more of the progress that can be done in the services that we offer. But really communication and just talking about what we do. And, people kind of think, oh, we just treat orthopedics or, people after strokes, or hip surgeries, knee surgeries. And that's just not the case. So it's really talking about, what we do in the public and for people just to kind of talk about it and get our name out there.
Right, and have an open line of communication with your doctor, so
Yes.
let the doctors know about everything you have on these. I know you have multidisciplinary teams that work together to take care of patients.
Absolutely.
So can you show us some examples of the exercises? Say you wanted to build strength in your arms. What do they need to do for that?
Oh my God. Well, I mean, you have your general,
Do you use weights? And
weights.
things
We
like
use
that?
dumbbells. We have cable machines. We use a lot of TheraBand, the stretchy bands, the loop bands. We'll use kettlebells or the resistance balls. And then also, if it could be simple, if they have resistance pieces, just to work with grip strength. So it's a bunch of tools in our toolbox, I guess
So
you
you have
could
all kinds
say.
of tools. Well, good. The most important thing is tell us how this benefits the patient.
Oh my gosh, in so many ways. Just getting on a regular, just an exercise program. Again, we go back to talking about that evaluation that we do in the beginning, and we ask the patient what's their goals. Getting them on a program of general strengthening. But then getting more specific to their needs and making it functional. What were they doing before? And if they want to go fishing, they need to get in a boat, So we'll put them on a balance board or a BOSI board and work on balance so that we work on their stability.
Do you have any other advice for these patients who are currently experiencing these symptoms?
I would definitely recommend that they advocate for themselves. They talk to their doctors more on a regular basis than we do. And especially even before they come to us, if this is something that they're experiencing, these symptoms, they may brush it off and think, oh, it's, for one reason or the other. And they don't mention it because it doesn't technically, or they think that it doesn't have anything to do with the cancer or the treatments they received. But being that advocate for themselves, talking to their doctors, communicating with their doctors and being like, hey, this is what's going on. My balance is not right. I don't feel stable. What can I do? And then having them mention, should I go to physical therapy or occupational therapy? And, kind of just getting that ball rolling as soon as possible. Because the other thing that we've learned through all of this is the sooner we can get these patients in, the better the outcomes. The longer you wait, the longer these deficits go on and have the potential to worsen. So the sooner that we can get these patients in, the better their outcomes.
Great. So open lines of communication, and the sooner the better.
The sooner the better.
All right. Those are our takeaways for today.
Yes.
All right. Well, thank you, Jessica, for being here and
Thank
sharing
you.
this wonderful information with everyone in our
Thank you
community.
for having me.
You're welcome. If you're interested in learning more about Terrebonne General's chemotherapy-induced peripheral neuropathy rehabilitation program, please call 873-3555. I'm your host, Rhonda Alfred. Thank you for tuning in onto Your Health. I'll see you right back here next week.